Saro Dispensary in Homa Bay County is one of the community health units in this region caring for hundreds of expectant women. The number of deliveries have over the years increased in this dispensary since the putting up of this community health unit. But this has not always been the case some years back. Many women in this region prefer to deliver at home under the care of traditional birth attendants, a situation that put many of them at risk of not only death but also developing pregnancy-related complications. But all that is now changing. Community health workers working under the community-based healthcare strategy ensure that those expectant deliver in health facilities whenever possible. Florence Agutu is such one community health worker in charge of several households within this community, where she identifies expectant women, whom she then refers to the Saro Dispensary for antenatal care.
I'm supposed to visit 87 households within the village.
Agutu's day begins with visits to these homes. On this particular day, she learns that one of her clients has delivered. Jacqueline Odhiambo gave birth at home.
As far as she's concerned, I'm here to see that she's doing exclusive breastfeeding. In case of any problem, she's to inform me. Then we talk together over it. Then we take to the hospital if it can be taken to the hospital.
She documents data collected from the community for recording at the health center. Professor Miriam Were, the Goodwill Ambassador for Community Health Strategy, has been at the heart of ensuring community health service takes shape in the country.
If you are in a nation where children are dying and expectant mothers are dying, it's almost like you have no future. Community health strategy approach to establish community health services was the most wonderful thing that has happened in our country for a long time.
Acting Bigori Medical Officer of Health, Charles Obemba, says since the inception of community health strategy, tremendous progress has been realized in the community.
We used not even to conduct deliveries in Saro Dispensary. But this time, we are conducting up to 10 deliveries per month.
The number of women who die during childbirth in Kenya is still high. The World Health Organization states that 360 women die in Kenya for every 100,000 women who give birth. Professor Miriam Were knows too well how serious the situation has been.
It became a big shock in 2004 that in Kenya things were getting worse, not better. It was realized that the reason things were getting worse is because we had focused on working only on health facilities, but we had forgotten the people. Right now, we have 2,511 community units which are providing community health services. But we are still far because we need over 8,000 community units in order to cover the whole country.
As a community health worker, Agutu has had to face challenges. Religious beliefs in this community is such that some mothers do not take their children for immunization. But that has since changed, as she explains the benefits of immunization to them.
When I came here, she took the advice and responded very well. Now she has taken her child to the facility, and the child also really got the first vaccines.
We used to have very low immunization coverage in this region because of the sect which is around here, where most children are not allowed to come for immunization. But through the community health workers in the community unit, there's a lot of improvement where almost all children come for immunization.
Professor Were is however optimistic that with this initiative, lives of many expectant women will be saved.
No mother should have to have a baby dying in her hands when she's just by herself. She will have a community health worker. That is our target. That in the next 5 years, hopefully in the next 3 years, we should have a community health worker in every community.
And I think this is the way the whole country should go, that we accept each and every part of this country to have a community unit to access the community easily.
Maria Ambo reporting for Health Matters.